you. And joining us now is Dr. Shika Jain. She is a board-certified physician in hematology and oncology. So, Dr. Jain, let's start with these malaria cases, if you don't mind. Is this cause for concern?
I don't think it's cause for panic, but I do think it's cause for concern. And I really think we need to look at the underlying reason why we haven't seen malaria in 20 years and we're seeing it now. And some of it can be attributed to climate change. We're seeing more warm weather for longer periods of time. We're seeing environments that might be more amenable for mosquitoes that are carrying malaria to live in these warmer climates. So again, emphasizing that this is not a contagious disease. You cannot catch it from someone else, but you can catch it from mosquitoes. And so it's not a time to panic, but it is a time for us to consider, why are we seeing more mosquitoes with malaria in the United States, giving it to people in the United States right now?
Absolutely. And another topic affecting many people and their struggles with weight loss, there are a couple of new weight loss therapies on the horizon that have the possibility to actually rival Ozempic. So what should people know before trying some of these additional medications?
It's really important to remember that when you're taking these medications, it needs to be with your doctor's recommendation and prescription and guidance, because you need to be monitored, because there are potential side effects, both short-term and long-term, that you need to make sure you're taking care of with your doctor. Also, some of these drugs are not yet approved for weight loss, although they have the additional effect of resulting in weight loss. Some of these are only approved right now for diabetes. So you need to make sure that you're taking these medications under the guidance of your doctor and make sure you're being monitored while you're on these medications.
So what are some of those effects, doctor? And are these medications that people can take the rest of their lives?
So some of the side effects we're hearing people talk about are nausea, constipation, diarrhea. Some people are getting some fatigue, a little bit of loss of muscle mass. So these are some of the short-term side effects. Some of the studies did show long-term side effects like pancreatitis or thyroid cancer. We haven't had these drugs around long enough to know what the really long-term effects are. So if people are on them for their whole lives, we don't really know yet what those long-term effects will be. Time will tell. But again, there are short-term and long-term possible side effects. So again, important to consult with your doctor.
Absolutely, and certainly important to acknowledge those. Finally, the FDA wants to start doing clinical health trials using psychedelic drugs as behavioral health treatments. This is fascinating to me. Substances like magic mushrooms or LSD could be used to treat things like PTSD, depression, and anxiety. So, doctor, isn't the point of some of these drugs to make you hallucinate? How can that actually help in these cases?
Well, that's a great question. And the way these drugs work, yes, they can cause hallucinations, but they do have an impact on your brain chemistry, on your serotonin, on your mood. And so there's a thought that there may be some benefit in people who have specific mood disorders. Remember, in cancer care, we still give tincture of opium to some patients who have diarrhea. So these drugs can be regulated and they can be monitored and they can be tested to see if there's certain dosing that would prevent having significant hallucination, but would allow to have some mood stabilizing effects or mood altering effects that might help patients who have mood disorders like depression. So more to come on that. I'll be interested to see how those clinical trials play out and what we find.
I think we all will be. We've got about 10 seconds left, but the FDA just laying out their initial plan here. So how long until this could actually become a possibility?
I think it's going to be a little while because we've still got to go through the trials. We need the trials to see what dosing is appropriate. So I think it's going to be a little bit of time. We're not going to be seeing it on our pharmacy shelves tomorrow or the next day. So a little bit of time, but these trials are going to be really interesting to watch.
Certainly will be. Dr. Shika Jain, thank you.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.